This is the MIST trial. It's the first randomized controlled device study designed to look at the link between migraines and the hole in the heart. And we have been listening right now to Dr. Peter Wilmshurst, who is the consultant cardiologist at Royal Shrewsbury Hospital in Shrewsbury, England, as well as Dr. Andrew Dodson, who is the director of the headache service at King's College Hospital in London, England. On the stage at this time, we see Andrew Dodson, who is the headache specialist, and he is right now explaining the clinical trials and exactly what took place. I don't have any specific results for you as they're being released as I'm standing here live. What I will tell you is the patent foramen ovale has been studied in this, the first double-blind study where that placebo effect is being looked at. I know there's been a higher placebo effect in past studies. What they've done to help to eliminate those issues, in this case, all patients in the MIST study had general anesthesia and transesophageal echocardiography before randomization to determine the presence and the size of the PTO. Now, the patients who were assigned to the sham intervention woke up from anesthesia with a cut in the groin, just like the treated patients did. To avoid the possibility of placebo effect or bias in determining the effect of PFO closure and migraine frequency, and also the security of all patients involved. What I will tell you is that by the time the study took place, let me get my numbers straight here, we ended up with about 135 people who did complete the trial, about 73 sham procedures, 74 implants, losing a few due to some issues throughout the study. No deaths were reported. We did get a report of the missed serious adverse events listed for both the sham patients as well as the implant patients. There was one stroke, however, that was in a sham patient, and that was discussed here. She had no significant issue after that. So if you want more information about this, clearly the slides and the information will be released. Again, this is the MIST study. It is being released as we speak. And to let you know, we are getting information. PFO closure is accomplished by threading a catheter through a femoral vein in the groin into the right side of the heart. We've been talking about catheters, sizes of PTO here as well. So Dr. Wilmshurst has done a wonderful job, in my opinion, even as a patient here, and Dr. Andrew Dodson. And now again, we are going to return to listen to the headache specialist, and I will return back to you in the studio, and in fact to Randy. Randy, do you have further comment here? I will continue to get the results. We will continue with ACC TV News to bring you these late-breaking clinical trial results as quickly as we can record them.
Sean, I don't know if you can hear me, but this is a very, very fascinating trial. I think it's one that not only many of us are going to be interested in, but I know the media is going to be interested in. So I'm dying to know what the results are, so I hope that you can get that. But you're exactly right. PFOs, or patent foramen ovales, as we know, probably occur in 25% of the population, so they're very prevalent. And there's been a lot of work, actually, in the area that I do, the transesophageal echo, and guiding our colleagues in the cath lab and closing these with little devices to prevent the occurrence of what's called a paradoxical embolus, where a little blood clot from the right side coming up from the leg veins would go across and cause a stroke. This is a whole nother issue, and this is a gigantic field. If you think about all the people that you know who have migraine headaches, and the concept that you could close this hole and somehow impede various chemicals that the body might produce or things that would cause a migraine to occur by closing that hole, that you would prevent migraines or decrease their severity, is a very, very interesting concept, but it's a staggering concept. If you think about the frequency of migraines in the population and the frequency, Rhonda, of trying to, of the people that have this PFO. So this has got great implications and of what's going to happen. So
I think, Randy, too, you'll be interested that they did quality of life checks throughout the study monthly. So I think as a patient or as a layperson, that's going to be part of the finding that we see most important.
Well, I mean, there's no doubt. I mean, I've got family members who have migraine headaches, and they're totally disabling. But this is a giant step to say that if you have all the population with migraines, and as you know, there are migraines with auras, which some feel are the more serious type, without. But if you had this population, and if this study said that these devices might help to minimize the migraine attacks or minimize symptoms, that's a staggering sort of finding for the implications it would mean about whether people should have their PFO closed if they have one. I mean, I can only imagine what consumers would do. Rhonda?
Well, a question for you, Randy, is I know that it is controversial whether or not to close up
Absolutely.
the PFO because of the possible risk of a TIA.
Absolutely.
So if that's controversial, I guess it's quality of life.
This is adding a whole nother level of controversy to this. But I think, you know, the interesting thing is that, as Sean, or as you were saying, they're doing these quality of life measurements. And it's really interesting when they do a sham procedure. In other words, these people had, the people that didn't get a closure device in their PFO had general anesthesia and had a transesophageal echo, and then they woke up with an incision in their groin where you normally would put the catheter in. So they thought they might have had the procedure. So it's a very interesting design.
And something else, I don't know if they'll look at this here, Randy, or if this is still open, what the mechanism might be with a PFO.
Well, there's been a lot of thoughts about that. We'll come back hopefully in a few minutes and be able to talk about that. So Sean, find me out the results.
I will. The distinguished panel will be asking questions shortly. I will get the results and we will be back with you. Again, this is the late-breaking clinical trial in regard to the MISS study at the I2 Summit in C3. I'm Sean Diddy. Now it's back to you in the studio.